Hello and welcome everyone. Welcome back to our webinar series, Next Steps in COVID-19 Response in Long-Term Care and Retirement Homes. In today's webinar, we are pleased to host a discussion with Wellness Together Canada to showcase the new virtual care portal supporting mental health across Canada. I will be moderating this session from my home office in Ottawa, Ontario. I would like to acknowledge that my home office in Ottawa is on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. From this territory, we are pleased to offer today's webinar with French simultaneous interpretation. If you wish to listen to this session in French, please select French from the interpretation menu at the bottom of your screen. We invite you to use either official language when entering your questions and comments in the chat box. This session will be recorded and a summary will be made available to review or share with colleagues who've missed it following the webinar. So the Long-Term Care Plus program and webinar series are based on the Reimagining Care for Older Adults report that was published in July 2020. This report focused on promising practices in 6 key areas that have the potential to reduce the risk of future COVID-19 outbreaks or mitigating their effects. And we are also pleased to offer this program in partnership with several different partners from across the country, including BC Patient Safety Quality Council, New Brunswick Association of Nursing Homes, CADTH, and CMA Foundation. It is now my pleasure to introduce our panel speaker for today. Dr. Anne-Marie Churchill is the Executive Director of Stepped Care Solutions. Anne-Marie is also a Research Fellow in Stepped Care 2.0 at Memorial University of Newfoundland. She has 25 years of direct clinical practice in community, hospital, research, and post-secondary mental health systems, with a postdoctoral specialization in anxiety treatment and certification in trauma assessment and treatment. Anne-Marie is the co-author of Client-Centered Diagnosis and Treatment in Mental Health and the book Counseling Insights. She has expertise in the implementation and practice of Stepped Care 2.0. She holds a PhD in experimental psychology, a master's in social work, and is a registered social worker in the province of Newfoundland. So welcome, Anne-Marie, and over to you.
Thanks so much, Tanya. It's great to be here. So thanks for inviting me on behalf of Wellness Together Canada. And thank you for everybody joining so that I get to share information on this amazing portal that's been in operation through the pandemic. We feel we've almost grown along with the pandemic. It's been quite a learning experience. We started in March 2020 when the Government of Canada, through Health Canada, put out a request for proposals for a virtual care to support people's mental health through this pandemic experience. And of course, none of us knew what this was going to be like when it started. We had a contract for 4 months. We thought maybe after 4 months, that would be it. As we've all learned, this is ongoing. And the mental health needs of people across the country has grown. We've all been challenged in one way or another, and we've had to adapt. And so this portal that is actually a partnership between Kids Help Phone, Homewood Health, and Stepped Care Solutions. So you'll see when I go through the portal, Kids Help Phone offers some crisis response programming as well as counseling services for children and youth. And Homewood Health have been in the EAP business for over 100 years. So they offer direct one-to-one counseling. And Stepped Care Solutions is a consultancy group that looks at how we can reimagine mental health care and substance use in the country, how we can actually provide care without barriers, and that people have some choice in that care. And so we've been working with provinces and territories before the pandemic to redesign their mental health care systems. And then when Health Canada had the call for proposals, we were very quick to join Kids Help Phone and Homewood Health to try to put together a portal very, very quickly. We stood this up in 4 weeks that could meet some of the needs. And as we've gone along, we're into it now for about 1.5 years, constantly changing, adapting, improving. And these demonstrations, as what I'm going to do here today, are extremely helpful in hearing what people across the country in different areas really feel they need, and for us to go back and think about how we can provide some of that on the portal. The portal wasn't set up to provide all kinds of care. Provinces and territories do a very good job. What the portal is trying to do is provide a baseline across the country where people can get what they're looking for when they need it, especially general introductory prevention, promotion, and some basic counseling. So what we know at Step Care Solutions, if people have information, they can better look after their mental health. And so we're really trying to provide information and some basic supports to help people maintain their mental health, improve their mental health, and really develop resilience. And so we're kind of in this live situation where we can practice that. And through Wellness Together Canada, we offer a lot of programming to support people to do that. Next slide, please. So it's a national portal, and it offers a full range of resources. One of the things we had to be really careful about was not to offer too much that overwhelms people when they come to the portal, but enough where there's choice. And we know that people have different needs at different times. And so we wanted to provide enough of a range where people could find what they were looking for at that particular time. So we offer, all of our program is evidence informed, offered by top level programs, vendors who have already been providing this service. And we've brought them together in one portal, really to support mental health, but also reduce the harms from substance use. We've set up the portal so that people can choose what works best for them. So having been in mental health care for many, many years, unfortunately, we've given the message that there's only one type of care, which generally is one-to-one counseling. And what we found out through the pandemic and through national polling is that not everybody wants to talk to a mental health professional or has the time. They would like to try different resources. And we know with mental health that if people know what's happening, they can better look after themselves. So we want to offer certainly one-to-one counseling, but also a lot of other programs that people can choose either to support if they're already receiving counseling or may down the road, but can support that in different ways. The other thing we wanted to do, and this is something Step Care Solutions has been working on both through the university level, but also through the provinces and territories and clinics and hospitals, is the opportunity for people to monitor their progress and their wellness. And you'll see I've been doing that since the beginning of the pandemic. I can see when I've been up and I can see when I've been down. And that really helps me keep track in a way that I can prevent myself from getting stuck sometimes in really negative thinking or low mood. I can reduce my anxiety if I catch it early. And so by monitoring my progress, by taking ongoing self-assessments, I can be in charge of that. And I can really take care to put things in place to protect my mental health, but also to reach out when I'm not doing so well. And the portal is calibrated, ongoing. We have feedback that people provide to us in the community, but also through different groups, specialists. We have working groups on substance use. We've been co-designing and working with different organizations across the country who give us lots of advice and feedback on how to improve. So we do what we call continuous improvement. We don't expect to get it right all the time, but we are committed to improvement. So we make constant changes and adaptation along the way. Next slide, please. So these are some of the resources and supports that are provided. There's immediate tech support, and these are trained crisis responders. I mentioned the self-assessment and tracking tools, so you can sign on and you can actually set up an account for yourself if you want. You don't have to, but if you want to track your progress over time, you can create your own account. There's multiple tools and apps. We have 64 resource cards just on the front page without any sign-on that people can try apps for stress reduction. They can listen to videos or read information or actually try some journaling. We have a Zen room in one of our programs, different videos that explain what anxiety is and how you can actually calm yourself down, regulate your emotions, learn to think in more helpful ways. So there's a lot of resources for that. I'm really happy to say we have peer-to-peer support. We have one-to-one warm lines, both in English and French. We also have communities of support. So people can sign up on a community platform and chat with other people, how they're doing. Some of these platforms are monitored by mental health professionals. So if somebody seems to be trying things that aren't working, they can support them, reach out, give them information or a connection to a counselor. We have coaching and e-courses. So before people go to one-to-one counseling, sometimes they just need coaching on how to use some of the resources. There's ongoing e-courses. So if I'm noticing that my anxiety is up, we have some really good courses on anxiety that people can sign up for and take exercises over time. They can do it over 2 weeks, 4 weeks, 10 weeks. And these programs are what would generally be offered in mental health clinics or through EAP programs, and people can do them through the portal. And then there's one-to-one counseling. So this, as I mentioned, is offered by Kids Help Phone for Children and Youth, and Homewood Health offer it through their program. Next slide, please. So to date, actually, I checked this morning, we get metrics every night, and usually there's 2 to 3 up to 5,000 new people a day are on Wellness Together Canada. We're now at about 1.67 million different people have been to the portal. And as I mentioned, it increases every day. It's being used across the whole country. So all the provinces and territories, there's representation. And what we've done is really try to address the most common concerns. So Mental Health Research Canada have been conducting national polling, but we also keep track on the portal. So people who are calling Homewood Health for counseling, we keep track of what are the primary concerns, also what people are accessing and what we're hearing from the community, either through primary care or through community groups of what are the major issues that people are coming in with. And throughout the pandemic, our research is showing us that anxiety, stress, low mood, and substance use are the top concerns that people are coming forward with. And then grief and loneliness is certainly not far behind. Although some people may not identify grief and loneliness when they call, that can often be what's really increasing their anxiety or low mood is grief and loneliness. And certainly working in long-term care, I'm sure you see a lot of that. And then the stress of the kind of work that all of people who work in long-term care and in healthcare are experiencing, and of course then anxiety and depression. So we've really tried to get some of the best programming available for these major concerns. And then certainly if people have other concerns, so we've had questions around things like eating disorders, bipolar disorder, and some other more chronic concerns. And then Homewood Health and Kids Help Phone would refer people to their provincial authorities for those kinds of resources, because Wellness Together Canada is really meant to provide that broad range. And then we're not trying to provide what the provinces are already offering. We're just trying to provide the basic level and certainly some intense programming on the concerns that people are experiencing through the pandemic. Next slide, please. So what's been really interesting is a number of communities and groups have reached out to us for specialized programming. And because this is a national portal, we really want to support, especially our healthcare workers, our long-term care home workers, federal public servants, veterans. So we've done some really interesting co-design. So these are groups that have asked what's on the portal for us. And what we've done is gone to some of the programs and vendors who are providing the programming on anxiety or grief or mindfulness, and asked if they would co-design with these groups. So for instance, MindWell, which is a fantastic mindfulness program. And mindfulness is so helpful for all kinds of concerns, from anxiety to stress, to just being focused on the job, to having better mood. So mindfulness is a really interesting, low impact kind of intervention where any of us can use it at any time. And MindWell does a really nice Take 5 program where you can learn to just many times during the day to just take 5. And when you're already doing things like brushing your teeth or washing your hands, just to learn to focus, which actually slows down the stress response, is a really useful program. So mindfulness got together with the Canadian Federations of Nurses Unions. We put them together in a virtual room, and the healthcare workers co-designed this program with mindfulness. So it's the Mindful program is led by healthcare workers and designed by healthcare workers on MindWell's platform. So that's just one example of ways that we can co-design and tailor programming to suit different groups to meet their needs. And of course, long-term mindfulness programs are difficult for people with not a lot of time, like healthcare workers, like people in the long-term care home, that just don't have a lot of time to be doing extra courses. So these are things that people can do during their day. So it's actually appropriate for the group that are tailoring the program. And as I mentioned, federal public servants, we're looking at some programming now for older adults. So working with some researchers and programs that serve older adults across the country and seeing how we could tailor some programs for that population. We've been partnering with first responders, looking at maybe on our app or on our other programs, how we can meet their needs. And then co-designing substance use programming has been really important. When we started, we focused mostly on mental health. Then we saw from certainly our polling, but also from a lot of groups, that substance use was a major concern. So we partnered with some of the subject matter experts in that area and have some really robust programming now on substance use. So we know we don't have all the answers, and it's just really important, like for groups like your own, first of all, to know what's available and then how we can better provide programming for those groups. Next slide, please. Okay, so this is the fun part. So I'm going to actually go online to the portal, show you some of the programming. You'll see my own account, and we'll have a look, and you can get to see what's going on with Wellness Together Canada. Okay, so here we go. I'm going to start from the beginning. You should be able, everybody now should be able to see the portal. I'm just going to move up my screen so I can see what you're seeing. Okay. All right, so this is the home page. And so right off, you'll notice that there are some banners that are going across the screen. You'll notice now the Indian Residential School Crisis Support. So one thing we can do at Wellness Together Canada is whatever current events are happening, or if there is something going on in the country that's really causing stress to a group, that we can create or partner with some vendors to create some programming. So that's what we did with the residential school crisis. We actually partnered with Indigenous Services Canada, some Indigenous artists and advisors, and provided both phone lines, crisis lines, but also resources where people can learn more about the residential school crisis and supports. So if you look up in the top banner, this is a whole new design. When we first started, I think it's okay for me to tell you that we failed forward. Our first design, we were getting feedback that it looked more like a Revenue Canada site. Not that that's a bad thing, but when you're trying to improve your mental health, that's probably not what we were aiming for. So we actually reached out to groups, we did some focus groups and redesigned the whole portal. So this is the most recent iteration of the portal. I think it's much better. And there were some things that people told us. They told us they really wanted to see, rather than just crisis line, to reach out to people right in the beginning if you need help now. So if people click up here, I need help now, what they will get is a list of resources that are answered by crisis responders. So there's the adult text line, there's a frontline worker text line, youth text line, Hope for Wellness phone number for Indigenous peoples. And then one of the things that we heard was when you call, so if you're calling for somebody who's in crisis or texting one of these crisis resources, they're really set up to provide crisis support for the person on the phone. And there was a lot of frustration that some people were calling for somebody else, someone they care about, or somebody they were looking after, and they were being asked the crisis questions. So what we did was we actually added this box here for if you're really worried about somebody else who's in distress, you can talk to a counselor immediately through this phone number. This is a Homewood Health counselor, and you can talk to them immediately and get their advice on how best to help somebody. So the crisis resources are really important. I can thank people who contacted us and thought we should have done a better job with that. So we've included it now right in the top banner and added the Homewood Health counselor. When you come down into the next banner, there are some headlines here. Some people like to access resources right from the banner without going into the site. So what we've done is created some basic drop downs. This is information about Wellness Together Canada, how to track your wellness journey, how to set up an account, some frequently asked questions. Some of the most common questions are, is this really free? And as a mental health provider, it's really sad that we don't have and haven't had free mental health counseling across the country, but Wellness Together Canada does do that. So it is free. It's always free, no matter what program you use on the portal. It's people say, when can I use it? It's offered 24/7. So if people come off a shift and they need to talk to a counselor, there are counselors available in French and English to talk to 24/7 for free. These are all professional counselors through Homewood Health. And then they have a Can Talk program where there's translation in 200 languages. So there's lots of programming. These are common questions we get. And one of the major questions we get is around privacy. Like, how private is this? So there's a whole privacy statement that we've improved on so people understand how this works. So if you just access a resource right from this front page, you don't have to give any of your information, and you can disable the cookies so that if someone else opens your computer, this is totally erased. Most people like to keep the cookies enabled, so when they come back the next time, they can pick up again. It recognizes you. The resources you used are easily to access, but people can choose not to have cookies. They can choose not to sign up. We've really changed the sign-in. I'm going to show you that because you're going to see my account. That was another improvement we made. We heard very clearly from people. Initially, we asked for your name, first name, last name, and your email address. And a lot of people were not creating an account because they did not want to give out their name. So we've changed it now. The sign-in is just simply, I don't know if I'll be able to do it because I'm already signed in, but I'll see, or it might just go right into mine. Yeah, so now it's just your email and a password. You don't have to give your own email. You can create an email just for this site and a password. So there's no, people do not have to give any private information. They don't have to give their name if they want to use the portal. So if they want to create an account, they can very simply do that just through a password and an email. And then, of course, there's I'll go back and forth between French and English. So if I click French, I'm just going to move down my bar here. It will just switch to French. And I can just toggle between the French and the English. So as you come down into the next banner, you'll notice trending topics. So there's a lot of things that people are interested in. And what we do is we update this regularly. Coping with COVID, especially now that we're into the next wave, a lot of people are asking questions about that. Managing worry, managing substance use. These are very common concerns right now, and then they'll change as time goes. And as other issues come to the forefront, then these will be switched out. Or if we hear from a group something that they want to see on the portal, I mentioned we can co-design, we can adapt, and we'll include new topics as there's requests or new issues arise. So you heard in the introduction, my introduction, that Step Care Solutions, both with Memorial University and with our organization, that we're looking at transforming the mental health care system so that there's lots of choice for people. So with stepped care, we believe that there should be choice, but there also should be open access so that people can get what they need when they need it and what works for them. And as we know, different things will work for different people. So when we first started, we just had counseling here and then a bunch of resources. Now we've really created a stepped care continuum. We're at the first step. Some people just want information. So they just want to learn more. If they click learn more or learn, then they'll get all of these different resources that I'm going to show you next. And they can tailor them for what they're looking for. If they click practice, they'll be brought to a sign up page where they can actually enroll in different programs to practice skills that will help support their mental health or develop their resilience. But some of these programs, you'll notice when I go down next, are offered right here on the homepage. There's lots of practice people can do without signing up. But if they want to engage in a full program, then they need to sign up so that they can follow the course over time. If they click connect, this is the peer support I mentioned. So we have different kinds of peer support on the program. On this portal, we have a peer support warm line, as I mentioned, in French and English. We have substance use peer support, and this is offered through CAPSA, which is the Community Addiction Peer Support Association. And they offer a number of Zoom programs or courses that people can just join Zoom right from this page and join a group to get some support around substance use. And then there's Together All, which is a community of support. So if you go on Together All and sign up for that program, you can join different groups to talk to other people about specific issues that you may be dealing with. And this is monitored by a mental health professional. And Together All is the group that's actually working with the Canadian Federation of Nurses Unions to do maybe a separate community for nurses. Veterans are looking at creating a separate community for veterans. And certainly that's something that we can accommodate. That's the peer support. And then the next option for people is to be able to track their progress. In order to do that, you sign up, you do a self-assessment, and then you can ask for to get notifications. So I just got one this morning. I've set up every 2 weeks that I track my wellness by 3 little short questionnaires. One is on mood, one is on well-being, and one is on functioning. And I can get that ongoing. Or you can pick Talk, and if you click Talk, you'll get, for adults, the phone number for Homewood. And as I mentioned, this is 24/7, access to a professional counselor. And if you pick Youth, you'll have the Kids Help phone number. So that's sort of the bucketed format of what's available. It's the step care continuum, everything from learning to practicing to peer support to tracking your progress to talking to a mental health professional. Some people aren't sure. They still get to this and go, oh, I don't know what I want to do here. So done a little sidebar here, not sure where to start. And if people click that, they'll get a program navigator. So these are people through Homewood Health who've been trained on this portal. Myself, other people on our team have trained them to understand the portal. So they don't tell people what they should access. They work really hard to find out what you're looking for and then let you know what's on the portal and where you can get service. So if people say they want to learn more, they want information, they're not sure, they can come down. This is what we call our resource selector to try out some of the resources. So some people aren't sure, they want to set up an account and they just want to try some of this. So I'd like to find resources for, if I pick adult, I'd like support with, if I say managing worry, you can skip this or it can really help you specify what it is you're looking for, managing worry. Then I'm giving this step care approach again. Do I want to talk to a professional? Do I want a guided self-course? Do I want to read an article? Do I want to do an online class or group? And depending on what I pick, again, if I pick talking to a professional, I'll get the counseling numbers. If I pick complete self-guided course, then I'll get lots of information from the programs that are available with an account. So there's the Mind Well Take 5 program. It'll actually take you through the activity so you can try it. This gives people a chance to understand what the programming is about and try some of it, see if they want to sign up for an account and do it over the long term, or whether they just want to keep coming back and trying different resource cards, trying out different options, and all of these give an intervention. So there's something for you to try. And of course, these are the sponsors. And then a lot of people are asking, well, what are other people doing? And how are people using the portal? So we have testimonials. These are people who've given us comments about what they're doing with the different programs. And that can help you decide what you actually want to try and to hear about other people's experience without ever signing on or committing to anything. It just, again, socializes people, helps them get comfortable with the portal. And then the privacy piece I mentioned is really important. It's important for people to know they can delete their account if they do have one at any time. You can access all of this without an account and without sharing your identity. All of the information and any personal information, if you sign up for an account, is held by GreenSpace. That's our tech partner, GreenSpace Health. And people can go on the privacy statement. Their link is there. But they do a lot of measurement-based care for clinics and hospitals, and they're our tech partner. So ourselves at Step Care Solutions, we don't see any of this data. We don't know who's signing up. Homewood Health hold all the data, and you can delete your account at any time. So if we take a look at what's behind the sign-in, so if we go into my account, and I'll just show you how some of this works. And I've signed up, that's my email and address. And what I'll see are my latest assessment because I've signed up for the assessment. So this is called my results. My mood lately has been lower. You'll see these are my latest results for mood, a 7 out of 12. My well-being is 41 out of 70, and my functioning is 27 out of 40. Better mood, better well-being, better functioning, higher scores are better. So there's lots of room for improvement for me here. But if I take a look at how I've been doing over time, so I can press show detailed results, and I can see over time what's been happening. So for instance, last year, and I mentioned I've been doing this since the portal opened to take care of myself and my own mental health. And tracking has been shown. When you track, it's like tracking your steps or tracking your sleep, that when people start paying attention, they actually get benefit from that. It helps them catch things earlier. It actually helps you improve your mental health by starting to do things. You can start to notice patterns. So you'll notice I started out probably pretty stressed and then did quite well in June and July. I'm an outdoor person. I know I was outdoors a whole lot more back then. And this is my mood. Red is my mood. Then the purple is my functioning, and then my well-being. And this probably is the most concern to me. My specialty is actually resilience. And I know there's things I could be doing to improve my resilience and my well-being so that I could be doing better, which would actually improve my mood. Because I've gone up and down. If you look at my mood here, it was pretty good in April. And then it's really taken a dive lately. So as I looked at that this morning, I knew I was presenting to you today. I thought, yeah, I haven't had any vacations since this started a year and a half. I'm happy to say it's coming up. And it's a good time for me to do that because this has obviously been a long slog for many of us, and it's time for me to take care of my mental health. That just helps reinforce my plan to take some time off. But if I wasn't taking time off, I might say to myself, what makes me feel better? Why was I doing better over here? And I might start trying to get better sleep or going for a walk in between Zoom meetings. So it's actually a prompt for me. So I really believe in the tracking. The research is very clear that people get better outcomes when they monitor their well-being. And then if I get my results, we go back to my results. And what will happen after that is I get tools and resources. And so after I get my results, I may get some suggestions. You might want to try some things that could be helpful for you. And then these are the programs that I mentioned. So these are self-guided. These are things people can do on their own. And MindWell is one of them. WellTrack is another. It's a wonderful program. It's specifically focused on anxiety, depression, and stress. And they have a Zen room and a journaling feature. And so it's an ongoing program, a cognitive behavioral therapy program, which is very effective for anxiety and depression. And so many people are using WellTrack. And then Tao is another self-guided, and they have over 150 educational sessions, from videos to activities you can try on a lot of different topics, such as wellness, substance use, relationship. They have one on sleep. They have one on chronic pain. So, and these are brief, short programs that people can follow, where they can learn skills, learn more about what's going on and how to improve in those areas. Breaking Free Wellness is also a cognitive behavioral therapy program, but it's for substance use. And so if people are having concerns about their substance use, Breaking Free is an excellent program to help with that. And then Breathing Room is a program that really helps people cope well. So it helps people find things that work for them, what makes them feel better or come alive, meditations, music, book suggestions. So Breathing Room is really a great program for wellness. And then Kids Help Phone and Home with Health have a lot of different programs that they offer that you can do on your own. So if people try something on their own, that's not enough. You can always do the peer support and coaching. So I mentioned Together All. ICANN is a program out of Nova Scotia. It's run by the Strongest Families Institute, and it's an excellent anxiety program, an 8-week program that they provide a coach. So you can do this manual program, and then you can sign up for a Zoom class where you're coached along in the manual. You can get advice from the coach or even from a group that are going through the manual as well. So that can be extremely helpful. And then if people are interested, they may want to do the Take 5, learn some mindfulness on their own. But if they want to sign up for a class, there's actually a professional instructor. It's called Studio B, and take you through a mindfulness class. And this is also what's happening with healthcare workers. We're going to be offering that program again, mindfulness for healthcare workers. There may be a lot of people in long-term care interested in that. So there will be a notice going out. We offer it once every 4 months, and people can sign up and take that course specifically designed for healthcare workers. All people, all pathways. So this is the peer support run by CAPSA for substance use. They also provide programming that accompanies Breaking Free. So if you're doing the Breaking Free program on your own and you want some support from a group, you can sign up. So it's only a matter of clicking the site and joining one of these Zoom classes that are put on by Wellness Together Canada and CAPSA. And then I mentioned there's also some for the Breaking Free program, support people on that program. And as you can see, that's offered at different times, and these programs are all offered in French and in English. This is the grief program I mentioned. So this is run by Homewood Health. It is a manualized program. If you want support around that, you call this number, and it's an intake worker with Homewood Health. And they will assign you a coach to help with the grief program if you want some support going through that. And once again, when you call Homewood Health, it's immediate care. So the intake worker will take some basic information and put you right on with a coach or a counselor. Then the peer support warm line, I mentioned that. Progress Place, run out of Toronto, are providing our peer support warm line. And then AKRP is the French one. And then some people may try these and say, oh, I still want to talk to a counselor, or they may want to go directly to counseling. And if they do, they click on the adult, and they'll have a Homewood Health phone number and text to get hold of a Homewood Health counselor. And if they click the youth, then they'll get the kids' help phone. So all of these resources are offered in different places on the portal. Some are offered directly right from the front page without any sign up. As I mentioned, if people create an account, then they can really get in-depth programming over time, and they can track their progress. I've offered a lot of information, so I'm going to stop there and stop sharing. And I'm sure people probably have questions, comments, probably some ideas how we can improve the portal, which I'm quite happy to take back to the team.
So thank you very much for that overview of the portal. Lots of positive comments in the chat, and also lots of questions, which I've been trying to keep track of.
For me,
Trying to keep track of. So we're going to go back to the top, and hopefully I will catch all of them. And apologies to those if I miss your question. So the first question is, I also have a question I'd like to ask at the end, but we'll start with these ones. So from the Ontario CLRI network, what trends have you noticed and who's actually using the portal? In long-term care, for example, are you reaching primarily leaders, frontline team members? Are you capturing that data for registered users?
It's an excellent question. Thanks for asking it. So one of the improvements or changes we're going to make going forward is we ask very little information. You saw that. And so what we can track right from the homepage, and that's through cookies, is Google Analytics. So we can track where people are coming from across the country. And I can tell you now that every province and territory has been represented, and it's about proportional to the population of each of those areas. So there's more people from Ontario using the portal, but it's only proportional. So it's being used across the country. We can also track ages. We can track gender. Our most, I would say most usage is the ages of 20 to 40. What's been interesting on this is male-female breakdown, in that we see more males using the portal than we see in clinical programs, which is really interesting. May have something to do with anonymity and access. We don't know, we're surmising, but it's interesting to see that. What else is through Google Analytics? So we can do age, we can do gender, we can do geographic location. But in terms of managers, federal public servants, healthcare workers. We're not tracking any of that, even marginalized communities at this point, because what we've learned is for every question we ask, there's more drop off. And so we have a philosophy. So Step Care has a set of principles. And one of the principles is we provide care first, and then we ask questions. So we're not in favor of long-term assessments. Often that's a barrier to care. And anybody here who's gone for mental health care has probably experienced this, where you get a full battery of assessment before you even get to what you're here for today. So we start actually with the opposite. The question is, what are you looking for today? If you have a counselor, the counselor will ask, what's your top of mind concern today? They won't do a full assessment. We go to assessment if that's necessary, and often that will be for specialized care. The downside is we're not getting the demographic information for improvement. So we are working with the UI UX, so the user experience team we have, the specialists in this area, of how to get the demographic information without interfering with people accessing care. And one of the ways to do this, and we'll probably try it in some of our tailored programming, is to ask people, are you willing to give more information? This can help improve the service. Or do you want to skip? So it's going to be second level questions. It won't be the first question. As a matter of fact, we've minimized. We used to ask age on that sign-in. That's gone. As you see now, it's an email and a password for that reason, because of the feedback from the community around this is a barrier. Going forward, as I mentioned, we'll have the second level where, can you tell us more? Do you want to tell us more to help improve? So that's where we're going to go with that. I hope that's helpful in understanding our approach. But we do need to get that information. So we need to be creative of how we can do it without interfering with the number one priority, which is providing care.
Yeah, that makes sense. A question for Patricia Sullivan Taylor is, would be great to promote this resource with health professional regulators across Canada so they can share with their members. Not sure if that's in your plan.
Oh, that's so important. So we do have a group right now. Actually, I just came before this webinar to a meeting. We have a stakeholder engagement team, and we're actually talking about B2B. And so that means, you know, group to group. How do we get this to primary care? How do we get this? We're actually just partnered with pharmacy associations where they will have bag stuffers that tell about Wellness Together Canada. We now have Health Canada have been wonderful in their promotions. Now in Service Canada, there's ongoing videos on Wellness Together Canada. So anywhere you think would be a good place for us to target to get the information, if you could send that along. I think there's probably even some Health Canada representatives on here today. And we're working so hard to get this information out. What we hear a lot in our feedback is, how come I didn't know about this? Why didn't my family physician tell me about this? And I recently talked to some family physicians because I've been involved in a research study on resilience for Northern physicians. And one of them said, how come we don't know about this? And I think, I know it's been a struggle, and we have put some really concerted effort into doing that. And you'll see a lot more about Wellness Together Canada in the next little while. And we're working hard at that. So if you have suggestions, it would be great to pass those along.
That's great. Agree with you. We also, when we fell upon Wellness Together Canada, we're like, what a great resource.
I know.
And that's why we're having this conversation today.
Yes.
The next question from Darla Matheson is, of course, great resource. Thanks for all your work. For older adults isolated in their home and in the community who don't have access to computer or aren't computer savvy, how do they learn about your service and connect with them?
So that's a great question. And one of our target areas right now is for older Canadians. So we're meeting with some subject matter experts on that. We met with some just this week in Nova Scotia to help us figure out how to reach those people. Now, one of the things about Wellness Together Canada, and I noticed here in Newfoundland recently, on one of the shows that a lot of older people in Newfoundland tune into, they just gave the phone number. So we're trying to do low tech. People do not have to go online. They can use that phone number and go directly to Homewood Health for counseling. We're trying to have many ways to get these services to people. And so some places and it's too bad with the pandemic, because my idea was in community centers, to set up in libraries, to set up centers where it's already on the computers and there can be a support person to help people, and to ensure confidentiality. They could show them how to use the privacy settings. So for me, it's about putting it in any, like up north where there's maybe limited technology? Are there ways that we can centralize it in areas where older adults are going anyway? But you're right, for people in the home, isolated, alone at home, they listen to certain programming, and can we get the phone number out there? And so that they can start to connect in that way. And some of the, like even for the anxiety program, the coaching can be done by phone. So it's figuring out the grief counseling is done by phone. So there's ways that we need to think about being creative here and going to the people who know. So this group was key to me. Like when I heard I was going to do this today, it was so exciting. During the pandemic, my father actually had a stroke. And so I've become extra involved with long-term care. He's now in a long-term care home, being looked after amazingly well. But I'm so tuned in to the people who are looking after him and who's looking after them, because the care they're providing him has been amazing. And the people, like even my father, I was showing him the mindfulness program because he can do that. And my mother, who's the first time alone by herself and her anxiety is up, I signed her up. I go up there, pick out programs that I think would be useful for her. So I think the coaching is really important. And if we could get some coaching programs on of people who are used to coaching older adults and partner with some of those around with the navigators maybe, and maybe that's the way to do it. But again, if people have any ideas, we're totally open, send your feedback. And we meet regularly to figure out how to do this.
So that's great, because you actually touched on her second question was about connections to community centers and where senior programs are held. So thanks for intuitively answering that question. The next one is from Lillian Hung. So clearly there's a need to get this information out there. Do you have a poster or key or knowledge translation materials that you can share more widely with participants?
We have a whole toolkit of those. Thanks for asking. It's been a big project, both with our Health Canada and our partners. So we have a wonderful toolkit. We're actually doing a booth at Canada Health Info Way, and we have a short video now that you can show, a running video. So certainly our representatives from Health Canada can help with that, and so can we. So by contacting, you have my contact here, free to give that, and I'll direct it around, but also Julie Drury at Health Canada. She has a whole team who can support that. And we have a toolkit, yes. And we would love for you to share that. And our KT people have been very involved with that.
That's great. So a comment and I guess a consideration for you from Julianne Morelli. So it's evident that there's much more recognition given to the contribution that essential family caregivers and chosen caregivers make every day. They're not paid and not fully recognized for the essential work that they do. Their contributions to providing care amounts to about 65 billion annually. So imagine healthcare delivery and outcomes without their contribution that goes largely unrecognized. So I guess, are there any considerations in developing programming for this care group in particular, so that it actually recognizes and values what they do?
Oh, I would love to see that. So you saw a little box up there that said frontline workers, but for this group of care workers, people who are, you're right, providing essential service really, and they go unrecognized. So one of the things is tailoring. And so for this group, if we had representatives from that group who would say, this is what we could really use. I mean, we've sort of thought what would be appropriate resources. One of the things we're developing right now are some peer support group that are monitored or facilitated. And so there's a Meet and Motivate that's coming up right now. We're doing, we want to do a companion one for older adults, but then for family caregivers, for informal caregivers in the stepped care model. The informal caregivers are absolutely essential, which is why we have peer support in there. That we honestly believe that clinical is one piece, but most of us will only use our informal networks. So we have to support those people. And so that's a group we would love to work with to see what would be, we wouldn't decide on what would be those resources, we would co-design. So we'd put them together with some of our vendors to figure out what would be a good program that would really meet the needs of this group in a way that's really culturally sensitive. Like, when are they available? How are they available? Obviously, this group is already taxed. So what would be really helpful for them? Same way we've done with the healthcare professionals.
Thank you. So we have another question about the data that you're gathering. So I think you've touched on that in terms of age groups. Are you also looking at types of issues most troubling for older adults?
So we haven't broken it down yet by cohort, but that's a really important piece. So we've actually put some extra resources recently into metrics, looking at impact, but now we're going to break down impact based on group. So that will be a really important piece. What we do have right now is, in general, what are the major concerns? And we've asked Homewood Health. They're the ones that would have most of that data, because that's the counseling resource, obviously. So for people who call, and so far the older adult group have been one of the, it's been utilized less by the older population. But I think that's an awareness issue. I think if people knew that this phone number was available to talk to a professional counselor, they would probably use it more. And so it's the awareness piece. But if we could get more of those people, we could break it down by age group then, around what are the major concerns, and that would give us some input. We could also start looking at, and that's what is happening right now, is looking at, for the ages that are coming in with the Google metrics, what resources are they clicking on that homepage? And so we can track that. Once people sign in, those metrics haven't been set up, but on that homepage, and there's, like I said, over 70 resources, we can track which groups are choosing or clicking on which resources, and that might give us some ideas as well.
Great. A few more questions while we still have a little bit of more time. Lots of engagement from our participants, so it's great. Are there trained peer support workers available? Do you have a peer support training partner?
Yes. So currently we're using Progress Place is the English, and they're all trained, paid peer supporters. We really consulted a lot with Channel in Newfoundland and Labrador. They sort of lead the way in peer support in the country for trained, paid peer supporters. And then the French side, the AKRP, are offering. So these peer supporters are trained, supervised, and paid, especially for this group. And so two things I want to say about that. One is I would love to see more tailoring of peer support. So if we had groups, say long-term care workers, to design some peer support for them specifically. That's what Together All are doing for veterans. So there's no reason why we couldn't do that. And then we would look for reps who could advise what would be appropriate. But then also for older adults. Right now, these two peer support organizations that provide the peer support, I haven't even asked them about their ages, so that would be interesting for me to go back and find out. But also, could we do some peer support training for older adult associations? And we use, so Channel offers a peer support training. CMHA, peer recovery colleges offer peer support training. And we're actually designing an asynchronous module for peer support training in a stepped care model, which really, rather than telling people what they should do, is helping people figure out what they need to do. So we're just developing that module as well. So right now the peer support training would be offered by our peer support partners.
Great. And then the follow-up question to that is, how do you become a trained counselor on the site?
So trained peer supporters, right now with Progress Place, they hire all the peer support people. They train, they hire. So if you look up Progress Place, they're out of Toronto. You might want to check and see if you want to be on this portal right now. They're providing the peer support, so you could certainly contact them. And then going forward, you know, one of the things that Together All does is it allows us all to be helpers. So what we know from the mental health research is getting help is really important, but helping others is really important. It's such an interesting, even in my clinical practice, when people are doing better, I'll often suggest if they want to support somebody else. And we know that by helping others, it improves your own mental health and your insights. So Together All is a peer support community. Anybody can do that immediately. So if you're interested in doing some peer support now and you're not sure how much time you have and you don't want to be a paid employee of an organization, you could sign up to Together All and join the community online and support other people. And that's the one that's monitored by a mental health professional. They're called wall guides, I think they're calling them. And they just make sure everybody's okay. But really, it's run by the community. So it's a great way to get involved right now to support other people. And we have a new vendor coming on through CMHA, Canadian Mental Health Association. They have a program called Well Central, which is a program you can sign up for to improve your own mental health. And they're going to be adding a piece on how to help others. So there's lots of opportunity, but if you're interested right now in doing that, I would say Together All is a low entry point where you wouldn't have to invest too much, but try it out.
Great. And then another comment about specific resources for family caregivers in long-term care. So there's definitely a need in this space. And I'm sure there would be many on the call today who would love to co-design with you what that would look like.
We would love that. That would be fantastic.
Maybe we'll try a few more questions. We're at 55, so we'll get them short. So what have been the costs to date to develop this site?
So it's in the public domain. This is a project of the Government of Canada, specifically to support people across the country and Canadians abroad. And it's $65 million a year, covers the portal. So, and I can say that it's in the public domain. That's been the commitment. And that's what has been set aside right now for the portal for the year. And that covers all the counseling, all the vendors, all the work.
And have you received any requests to support the resources in other languages beyond English and French?
At this point, we haven't. We've partnered. So we've done a lot of outreach and discussions with newcomer organizations, cultural organizations across the country. And I think it's a great idea. So this came up in a call a few weeks ago, another webinar I was on. And I brought it back to the team, and people are really looking at, are there some ways we could partner with those organizations? I mean, I think what they could do is find a way to translate or deliver it in their community organization in their language. So that's something we're looking at, the best approach to that. We have stable funding right now, so there isn't extra. But with what we have, we can do tailoring. So if people have ideas and I will say that the older adult population, the family caregiver and informal caregivers are a target for us. It's something so I was excited to be here today because we're having conversations right now about that. So if there's reps or people who want to be involved in the conversation, I can certainly make that connection with the group we met with last week.
That's great because there's lots of support for co-designing resources, both for the long-term care workers, but also for the older adults and the essential care partners in this space.
I would love that. Yeah, that would be wonderful.
Well, thank you so much, Dr. Emery Churchill, for this great conversation over the past 45 minutes. Lots of engagement, so that's really great. So just would like to thank both you and to all our participants who participated today, both from our Long-Term Care Plus program and from our Learning Together program, supporting substance use and homeless shelters. So it was great to have all of our program participants in this one call today to hear about this great resource.
Tanya, will you provide Julie's information? I see all those things coming up about co-design, and we wouldn't want to miss those opportunities. So we'd love to get in touch with people.
Absolutely. So whatever contact information you would like us to share more publicly, we're happy to do that.
Okay, I'll send you along. The only reason I wouldn't give mine is I'm on vacation starting tomorrow.
That's right.
So I don't want it to lag. I wouldn't want people to send it and not hear back. So we have some people on our team. I can provide their email to you after the call.
Sounds great.
And Health Canada, of course.
Perfect. So we'd like to really appreciate everyone on the call today taking some time to provide feedback on today's session through our interactive poll that you now see on the screen. For the Long-Term Care Plus program teams here today, please note that our next webinar is on October 18th with Janice Keefe and Pamela Fancy, who will be providing a deeper dive explanation on family communication best practices during COVID-19. We also have a Long-Term Care Plus huddle on October 14th, where we're going to be discussing nutrition in long-term care with Camille Sabourin, nutritionist at the CIUS de l'Estrichu in Sherbrooke. And we also, again, like to thank all the Learning Together teams who joined the webinar today. The next Learning Together huddle is on October 7th, 2021, and we'll focus on moral stress, injury, and service providers during the COVID-19 pandemic with the Center of Excellence on PTSD. And the next Learning Together webinar is on October 15th, and we'll focus on equitable care, the palliative education and care for the homeless, or PEACH program, with Dr. Nahid Dasani, Inner City Health Associates. So thank you again to our speakers for the engaging discussion. We hope that all of you in the audience found this session informative, and we thank you for joining us today. This does conclude today's event, so have a great day, everyone, and take care.